Adenosine deaminase deficiency, also referred to as ADA, is a genetic disorder that causes severe combined immunodeficiency, also known as SCID. ADA is inherited in an autosomal recessive pattern. Homozygous patients will exhibit the SCID phenotype, with a severely damaged immune system lacking virtually all protection from bacteria, viruses, and fungi. Oftentimes, SCID patients will experience severe and life-threatening infections, which arise from normal flora that does not cause disease in people with a normally functioning immune system. Opportunistic organisms pose a serious threat to those patients. ADA symptoms include pneumonia, ear infections, widespread skin rashes, chronic diarrhea, slowed growth in children, and developmental delay. Infants with ADA are typically diagnosed by 6 months of age and do not usually survive past 2 years of age. Adenosine deaminase deficiency is extremely rare, occurring once in every 200,000 to 1 million newborns worldwide. ADA is responsible for about 15% of SCID cases. ADA is caused by mutations in the ADA gene, which encodes the enzyme adenosine deaminase. Adenosine deaminase is found throughout the body, but is most active in lymphocytes, the basis for adaptive immune response. Functional adenosine deaminase eliminates the toxic molecule deoxyadenosine, which is produced during DNA breakdown, to non-toxic deoxyadenosine. When adenosine deaminase is not functional, deoxyadenosine accumulates to levels that are toxic to lymphocytes. This leads to large numbers of developing lymphocytes being killed off before they are mature enough to fight infection. Other lymphocytes are also greatly reduced. This reduction in lymphocytes leads to the SCID phenotype. There is also evidence to support that a lack of functional adenosine deaminase leads to the inhibition of DNA synthesis and repair, which could contribute to the slowed growth and development seen in some patients. To test the function of adenosine deaminase, I propose generation of a mutant mouse with null ADA mutations in both copies, via mating of heterozygous mice with one copy of a null mutation in ADA. However, it is likely that such a mouse would die before birth, so I propose the partial rescue of ADA gene function via a transgene that would produce ADA in the placenta, thus allowing the mutant mice to survive the gestation period. By comparing these homozygous null mutants to their siblings with wild-type ADA gene function, I should be able to phenotypically determine if the double mutants exhibit SCID as a result of ADA knockout.